My name is Christina Johnson, and this is my final report for HMLF 636 for our Survey of Healthcare Administration. So I have opted to make a little video regarding the powerful concept of healthcare and the iron triangle, how remote patient monitoring, or RPM, might just be the missing link of improving care for people who live in rural areas like Georgia. I've personally worked in telehealth doing health coaching. I'm not a provider per se, but I'm a helper. I'm a medical assistant. I've done telehealth and I've never really done RPM. So I've worked in cardiology before, and I've seen how the pacemaker technicians would RPM the patients firsthand. So I thought that was pretty cool. So let's explore how technology can make healthcare more accessible, affordable, and higher in quality.
First, let's look at the iron triangle. The iron triangle of healthcare was introduced by William Kissick. It represents the three main goals of healthcare systems: increasing access, improving quality, and containing costs. The challenge is that improving one side often affects the others. For example, when we're expanding access, there is a high probability that we will raise costs or strain quality. Healthcare leaders constantly try to balance these three sides, but the triangle is rigid. When one improves, another often suffers. The goal is to find innovative approaches that can break this trade-off, and that's where remote patient monitoring comes in. Georgia has rural health challenges. In Georgia, rural communities face major health barriers. More than 120 counties are classified as rural, and many have lost hospitals or primary care providers. Patients often drive over an hour to see a specialist, and chronic diseases are more common, making access a serious challenge. What is patient monitoring, or RPM? It uses connected devices to collect and transmit patient data to help providers monitor the patients from home. This allows clinicians like doctors, nurse practitioners, physician assistants, or technicians to monitor conditions like diabetes or heart failure daily, catching issues early and reducing the need for frequent in-person visits. So my experience in cardiology and telehealth across Georgia, I saw how technology bridges the gap between patients and providers. Like I said earlier, pacemaker technicians, for instance, remotely monitor patients' heart rhythms, an approach that inspired the broader concept of RPM. Now, RPM and the iron triangle. Here's how RPM strengthens each corner of the iron triangle. It increases access for patients who live far from clinics. It improves quality by detecting issues early, and it reduces costs by cutting down unnecessary hospitalization. RPM in Georgia, evidence and examples. Here in Georgia, healthcare systems like Wellstar and Piedmont organizations or hospitals have begun implementing RPM programs, particularly for heart failure and chronic care management. Georgia Medicaid now reimburses for certain RPM services. This encourages broader use. These programs are already showing lower readmission rates to the hospitals and urgent cares and nursing homes, and improve patient satisfaction. Now, we always have barriers to implementation. Despite its promise, RPM faces obstacles. Also in Georgia, broadband internet remains limited in some rural counties, and not all patients are comfortable using connected devices. Reimbursement rules are improving but still vary by payer, and providers must integrate new data streams into daily workflows. On this slide, we see the future of RPM in Georgia. Georgia is making progress in telehealth and digital health infrastructure. The future of RPM will likely improve artificial intelligence to predict health declines, integration with electronic medical records, and partnerships between academic centers and hospitals to expand preventative care. So, in conclusion, RPM strengthens all three sides of the iron triangle. Key to improving healthcare equity is all across Georgia. So, remote patient monitoring represents one of the most practical ways to enhance access, improve quality, and reduce cost, especially for Georgia's rural and underserved population. It aligns with the goals of the Iron Triangle and supports a more equitable, connected, and proactive healthcare system. And thank you again for everything. And I hope we all pass with flying colors. And thank you to our professor for all the hard work and the lessons. We hope to see you again in other classes.